welcome to Veteran Connection, VA Butler Healthcare's cable show. We bring important news and information to our veterans and to friends of VA Butler Healthcare. I'm your host, Cynthia Closkey. Thanks for joining us today. In this episode, we're going to focus on behavioral health. Our first guest is Army veteran Brian Couch. Brian served in the United States Army for 22 years, serving 5 combat tours of duty. He came to VA Butler Healthcare in 2008 for behavioral health care, including PTSD, post-traumatic stress disorder. In October 2011, with help from the Wounded Warrior Project, Brian received a PTSD service dog named Slate to help him with many tasks, including picking up things, reminding him if he forgets to take a prescription, and even helping him with social interactions. Welcome, Brian, and welcome, Slate.
Thank you.
So tell us a little bit about when you first came to VA Butler Healthcare.
I came to VA Healthcare in 2008, 2 years after I retired.
Mm-hmm. What symptoms or signs did you experience that caused you to decide to come in?
I was staying in my house and not coming out doing anything. I didn't want to have anything to do with society. Mm-hmm. So
it was probably really hard to kind of re-engage with the people around you.
Very difficult.
Wow. What behavioral health services did they suggest for you?
The PTSD clinic in Clarksburg, West Virginia, VA, and there was also one in Coatesville in Pennsylvania too.
What's that like?
It's difficult, but everybody else that's there with you is a veteran and they're going through the same thing, so it does help a lot. It helped me out quite a bit.
Mm-hmm. So that was 2008. What's been the most difficult thing for you?
Still getting out into like malls and very crowded areas.
Okay.
Movie theaters and.
Are you able to do a little bit more of that now than you could before?
Yes, because the service dog that I has me focus on him and not on everything else going around me.
Sure. So this is just you've had Slate for about a month, is that right?
Yes.
Tell us about Slate if you can.
Slate's a PTSD balance and brace service dog for me. Mm-hmm. He detects accelerated heart rate and anxiety. He wakes me up out of flashbacks and nightmares when I'm sleeping at night. And since I have some degenerated bone in my ankle, if I go on down stuck in a ground position, there's nowhere to get up, I can give him the command brace and he'll lock his legs so I can use him to get up with.
Oh, wow. So. That's great. He seems like a really nice, he's very friendly to people.
Oh, yes.
Are you comfortable when people talk to him or talk about him?
Yes, I have to introduce him to the individuals first and then they're allowed to pet him.
Is that part of the training?
Right.
Okay. Is it just like almost like a seeing eye dog then in that way?
Yes.
The dog's working throughout the day.
He's working throughout the day until I introduce him to the individual, then he's allowed to be pet.
Are there other programs and services that have been helpful for you through the VA?
Yes, the PTSD, OEF clinic group that we go to, and the Seek and Safety group, which gives you scenarios and you have the therapist there to help you break it down to work on it.
Do you have advice for other veterans or their families who might be experiencing similar problems to what you've had?
Yes, don't sit in your basement and waste your life away or in your dungeon, and come in and get some help. It's not, at first it's embarrassing to admit you have these, but you're never going to get help if you don't come in, so.
Yeah, so they should come in. It just takes time, right?
Yeah, it takes time.
But also having people connect with you.
Right.
That's terrific. Thank you so much for sharing your experience. I'm sure this will be helpful to some other folks.
Thank you.
Welcome back. Now we're going to talk with Dr. Mary Jane Niebauer, psychologist and coordinator of the PTSD treatment team at VA Butler Healthcare. Thanks for joining us, Janie.
Thank you.
What behavioral health care services does VA Butler offer?
We have many services here at VA Butler Healthcare. Some of them are psychological evaluations, which is one of the first steps that people do when they come into the Center for Behavioral Health. We also do individual and group psychotherapy. We have many different types of group psychotherapy depending on what issues you're struggling with. Some of those are for depression, for post-traumatic stress disorder, and also for various types of substance use disorders.
Who coordinates behavioral health care?
We have several teams set up in our center. One of the teams is for post-traumatic stress disorder specifically, and that's a team that I lead. We also have a team for substance use disorder, and then we have kind of a general mental health team, recovery team. And so people who are struggling with symptoms more like general anxiety or depression are sort of referred to that team.
Okay. And then is all of this confidential?
Yes, care is definitely confidential. Now we do enter our notes and our reports into our electronic medical record. The benefit of that is that other providers who might be seeing a veteran, such as their primary care doctor, can also access that information should they need to. And this is very helpful in terms of when veterans get medication, psychiatric medication, then our psychiatrists and nurse practitioners can coordinate with the primary care doctors through the medical record.
Make sure there's no conflicts of different prescriptions or duplication or anything.
Right, side effects, medication reactions, definitely.
Okay. How does a veteran know if they have mental health problems? It seems like something that's sort of, you can't really self-diagnose.
Right, sometimes that can be very difficult. I don't think any of us really likes to admit when we're having issues in various ways. We tend to get veterans referred for many different reasons. Sometimes it's a family member that will notice, you know, geez, you seem kind of to be more angry lately than usual, or you seem not quite yourself. And then the family member will say to their husband or son or daughter, I think you really need to go talk to somebody about that. So oftentimes it can be a family member. But we do have veterans who self-refer, who say things such as, after my deployment, I didn't quite feel myself. I felt like I looked at the world a little bit differently than I used to. So I really thought that I needed to talk to somebody about that. And some of the more common complaints can be things such as sleep problems, anger problems.
I'm sure there's a range of things that are sort of mild to things that are severe, like not being able to leave your home or feeling nervous in a crowd.
Definitely, yes.
So how can, if a veteran is even thinking that they need some services like this, or maybe feel short of it, well, how can they request behavioral health services?
There are several ways. One of the ways is when they see their primary care doctor, they can report their concerns to the primary care doctor, and the primary care doctor can then put in what we call a consult, which will trigger the staff in behavioral health to review the case and then schedule an appointment. Or they can sort of self-refer, which would mean just calling the Center for Behavioral Health, and they can access that through the VA operator. And just, you know, when the staff answers the phone in the front office, they can request to have an appointment.
Now, but what if someone's having something they might think was an emergency, like a mental health emergency? What actually, when I say that, I'm not even sure what I quite mean. I mean, I know if you're sort of feeling desperate or suicidal, that would be considered, but maybe there's more.
Sure, definitely. If you're having thoughts or feelings of hurting yourself or hurting other people, that would be considered a crisis. Sure. Other situations that can be crises is things like not sleeping for many days in a row, which can sometimes change the way that you view the world and change sort of your interactions with the world. Also, some more just severe forms of depression, not being able to get out of bed and things like that can turn into a crisis. If that were to happen, if it's during business hours, between the hours of 8 and 4:30, you can certainly present here to the VA, either in the primary care area or in the Center for Behavioral Health, and we would direct you to the right people. We do have staff that are specifically designated to meet with veterans on a crisis basis, and then we have other staff that sort of assist them. And if it's not during business hours, we have the Veteran Crisis Line, and the number for that is 1-800-273-8255 or 1-800-273-TALK. And so they're welcome to call that crisis line, and when they do call the crisis line, it comes up with a computerized voice that says, if you're a veteran, please press 1. And then the call is routed to someone who is specifically trained to work with veterans.
Okay. And that's probably important because a veteran might feel like the person on the other end of the line needs to understand what their situation is.
Right, and in those cases, the people answering the phone, in some cases will suggest that the veteran have a family member take them to the emergency room if the crisis rises to that level. In other cases, the staff person at the crisis line can talk to the veteran and talk them through how they're feeling at that moment. And then what happens the next day is that the Center for Behavioral Health staff would be alerted to the fact that that veteran had called in, and one of the staff members would call that veteran the next day.
And yet, even so, it still remains confidential within the team, right?
Yes, within the VA electronic medical record, right?
Okay.
Right.
Because that's probably a big, if you're having a crisis, I'm sure that that sense of I don't want anyone to know is even blown up.
Definitely, yeah.
Now, you've been with the team for some time.
A little bit over 4 years.
What are some of the common mental health issues that you see and treat?
I would say most frequently we treat post-traumatic stress disorder, of course, because we're treating combat veterans largely. Also, though, other forms of depression and anxiety, in addition to various difficulties with drugs and alcohol.
And what types of treatment are available with the VA Butler?
I mentioned a little bit earlier, but I'll go into a little bit more detail. We do have individual and group psychotherapy. Depending on what your diagnosis is, whether it's depression or anxiety or substance use, you would be directed to the various teams, as I had mentioned, and then you would have a case manager assigned to you. Now, the case manager's job is to sort of make sure that you get the treatment that's most appropriate to you, for your concerns, and also make sure that you get to the right groups and the right programming that you need. So in addition to the individual and group psychotherapy, we also have psychiatric practitioners that can provide psychiatric medication. That's both psychiatrists and also nurse practitioners. We also offer care from VA Butler Healthcare to our community-based outpatient clinics, and we do that through our clinical video telehealth. So for veterans who have difficulty getting transportation to the VA, I can actually be in my office here through a webcam and meet with a veteran on the other end at the community-based outpatient clinic.
And those telehealth cameras are a little bit high resolution. It's almost like it's much better than your average Skype or something.
Definitely, and it's very nearly real time, just a very slight delay. And so our veterans who have difficulty with their transportation or financial concerns in terms of getting here with the price of fuel, I think that they really appreciate that.
And then you, as a practitioner, can get a better sense of what's going on with them, like their facial reactions, and
Definitely.
It's more than just a phone call.
Right. We also use our clinical video telehealth for crises. So if a veteran presents at the community-based outpatient clinic and is not doing well in sort of a crisis type situation, our crisis staff can use the CVT machine, as we call it, to sort of assess that veteran and try to evaluate what should be the next steps.
That's excellent.
Another thing I forgot to mention is we do have a residential treatment program for substance abuse disorders. So that's kind of another layer of treatment that we have if you are experiencing a substance abuse or substance addiction and you need a period of residential treatment. We have a very thorough and comprehensive program to address that.
If there was one thing that our viewers should take away, what would you want them to know?
It's really important to me that all of our veterans in the community understand that the staff here at VA Butler Healthcare is very dedicated and really wants you to seek the services that are available for you. We have many services here now, which didn't used to be the case, and we really want to get the word out to you. If you're having any concerns at all, that you can present here and we will get you to the right people to help you figure out what you need.
Thanks so much, Janie, for sharing all that information with us today.
Thank you.
It's time to talk health and wellness with VA Butler's Health Promotion and Disease Prevention Manager, Karen Dunn. Hi there, Karen.
Hi, Cindy. How are you?
I'm fine. So you want to tell us a little bit about managing stress, is that right?
I do. That's one of our healthy living messages. And we talk about that a lot with veterans, especially related to PTSD. But just related to stress in general, we know everybody has stress every day. But you can tell if you have too much stress because your body will let you know. And ways that would be difficulty concentrating, heart racing, your sweaty palms, probably a little bit of irritability with other people, and probably feeling exhausted, things like that.
So even though people might have that a little bit on a daily basis, when it reaches too much of a level, you're seeing all of those symptoms. Is that right? Or some?
Right. Your body's going to give you warning signs, and those are some of them.
Okay.
I mean, everybody experiences it differently, but some of those are the signs.
And who can a veteran talk to if they feel like they're beyond just not feeling good, but in an emotional crisis?
Well, if they're getting so much stress that they don't feel like they can cope, they can contact our Veteran Crisis Line. The number for that is 1-800-273-TALK, and that's available 24 hours a day, 7 days a week, 365 days a year.
Great. How can veterans better manage their stress?
Well, we just recently started a new class at VA Butler in November. It's called Moving Forward, and it's to learn how to problem solve, which helps, to manage stress, and it'll help veterans with other things also. That's just one way. There's some other ways that we can do that. Physical activity definitely helps with managing stress. Relaxation skills, yoga. Managing time, making lists, such as, time management, try to prioritize things. Also, just positive thinking in general. Most stress is related to negative thinking, and that will help a little bit if you just use a little bit more positive thinking. One other thing probably would do, plan more activities that you enjoy in your life. Have fun.
Sure, make the most of it. Now, if a veteran is looking for some ideas or tips or resources, is there any place they can go?
Sure, they can check it out online for managing stress. We have information at www.prevention.va.gov, or they can call and talk to their provider, or when they come in for their next visit, they can just speak to them in person.
That's a lot of resources. Great. Thanks very much, Karen. We're joined now by the Acting Director for VA Butler Healthcare, David Cord. He's going to answer questions from our veterans. Director, what's our question today?
Well, Cindy, our question is, I've been having trouble sleeping and I can't stop thinking about some of the things that happened to me while I was deployed. Could I possibly have PTSD? As you may or may not know, PTSD stands for post-traumatic stress disorder. And while I'm not a clinician, I can tell you that that is probably one of the most common problems that many of our returning veterans face, particularly those returning from recent deployments in Iraq or Afghanistan. What I would encourage this individual or any veteran who feels that they may be struggling with PTSD is to contact us. We have a 800 number that they could call, and if I could give that number, it's 1-800-362-8262. And that would be extension 5039. And we also have a website that's dedicated specifically to PTSD through the Department of Veterans Affairs. And that website is www.ptsd.va.gov. Certainly, we have many providers here at VA Butler that are skilled in working with veterans who may be suffering from PTSD, and we would encourage this veteran or any to either call us or stop in and let us try to help.
Thanks, Director. If you have a question that you'd like the Director to answer in a future episode, please email it to vetconnect@zoominternet.net. That's our show for today. I'd like to extend a special thanks to our guests Brian Couch and Dr. Mary Jane Niebauer. For more VA Butler news and information, please visit our website, www.butler.va.gov. You can also connect with us on our social media pages, facebook.com/VAButlerPA and twitter.com/VAButlerPA. We would love for you to join us for our monthly podcasts at talkshoe.com/TC/85029. Thank you for joining us today. Check your local cable listings for the next episode of VA Butler Healthcare's Veteran Connection, where we are making lives better every day.